Okay, if everyone would take their seats, please. We are ready for takeoff for a very interesting, thoughtful, insightful evening of discussion and conversation. Welcome to all of you. It's quite the view from up here. So many people here, so many people we know on Zoom. We organize a lot of programs and events here at Darchei Noam. We're, I would say, a very dynamic community. I don't think we have ever had as high a pre-registration for a shul event as when 400 plus people registered to be at this event. So we have those of us who are here, those of us online through Zoom. I imagine others will be joining us in progress. So it really is wonderful to have all of you here. And most important, Dr. Philip Berger, what an honor for us to have you here and to hear from you. I'm Meyer Semiatiki, a member of Congregation Darchei Noam, and I'll be kind of the substitute moderator for today because the original plan was for our member Esther Enken to be in this role. And Esther sadly was called away for a family funeral and could not be with us. I'm very fortunate that before leaving, she passed along an outline for today's event. So a lot of the credit for success of what unfolds goes to our colleague and friend Esther Enken. So in a few moments, I will introduce Dr. Berger. He's asked me to be informal and refer to him on a first name basis, so I'll probably be flipping around between Philip and Dr. Berger for good parts of the evening. But first, before I say more introductory words about Philip, let me begin with a land acknowledgement and a leader tribute. Our Darchei Noam congregation is located on the unceded traditional territory of many indigenous nations, including the Mississaugas of the Credit, the Anishinaabeg, the Chippewa, the Haudenosaunee, and the Wendat people. Toronto continues to be home to many indigenous people from across Turtle Island, and we are grateful to live and build communities here. We encourage everyone to learn more about the indigenous origins and experiences in our city and in our country. And I imagine it's not lost on many that as we begin the program here, just winding up in Winnipeg, Philip's hometown, is the National Commemorative Ceremony honoring the life of Murray Sinclair, who passed away earlier this week. Murray Sinclair was an Anishinaabe judge, senator, and chief commissioner of Canada's Truth and Reconciliation Commission. As the Globe and Mail has said, Sinclair did as much as any figure in our country's history to right the troubled relationship between Canada and Indigenous peoples. You could say that to us now the torch is passed. In Murray Sinclair's memory, we encourage everyone to learn more about Indigenous peoples, their experiences in this country, and if you are able to support the work of an Indigenous-led organization. Here in Toronto, a good place to start is by visiting the website of the Toronto Aboriginal Support Services Council. That's the Toronto Aboriginal Support Services Council. The large turnout we have here in the sanctuary this evening and on Zoom is a tribute to Philip Berger, to his remarkable contributions over the years to healthcare and to fighting anti-Semitism. Philip will be reflecting tonight on both of these commitments and dedications that have very much defined his adult life. And we will bring, I'm sure, heavy hearts to this conversation, especially on this date. This is the anniversary of Kristallnacht, which would have started last evening and continues today. So we have heavy history, heavy hearts, and much to consider and think about as we gather. Let me start, though, also with a brief preview of how the program will unfold this evening, so you have a sense of what to expect. In a moment, we'll have words of welcome and hear about this Merkur lecture series from our assistant rabbi, Ryan Leshner. After Rabbi Ryan's remarks, Dr. Berger and I will be in conversation for about 30 to 40 minutes, and then we will turn the floor over to questions from the audience, both here in person and for those joining by Zoom. After that, we'll have closing words from members of the Merkur family who sponsor the Merkur lectures here at Darchei Noam, and from our senior rabbi, Tina Grimberg. For those of you on Zoom, here's how for everyone the Q&A will unfold. For those of you on Zoom, please put your questions into the chat. You can do so at any time. Our member, Rebecca Fish, Rebecca is to my left and is waving her hands. Rebecca will curate the questions that come in via Zoom, and she'll be relaying and posing some of those questions. And for those of you who are here in person, there is an index card and a doggy bag equivalent of a pen that you can take home with you if you wish. But before you take it home, we hope you may want to write a question for Dr. Berger. And we'll be collecting those questions and curating those as well. And I want to give a special shout out to 4 young people who are here with us. There are 4 students from chat who put up their hands when the school asked, would any students be interested in helping to organize and assist in mounting tonight's event? And 4 hands immediately shot up. And so I'm going to ask the 4 young people, students from chat, if they would stand up. And welcome to all of you, and you'll be getting your exercise towards the end of the session as you walk all around the hall and collect cards of questions that have been posed. So next, I think that it falls to me to call upon our wonderful assistant rabbi, Ryan Leshner, for his welcoming remarks. And here comes Rabbi Ryan down the aisle.
I'm used to gathering here on Shabbat, so I really want to wish everyone a Shabbat Shalom. It's like instinctive within me. I want to do it, but instead I'll say Shavua Tov. Good evening. It's great to be able to be here. And so tonight we have a great honor and responsibility. Tonight we gather for the 4th annual Merkur Lecture Series. It's an annual event here that we host at Darchei Noam. It's dedicated to exploring issues of social justice and equity. And before I sort of frame the obligation piece of what we get to do tonight, I want to make mention that this would not exist without the vision and dedication of Lord Merkur, Zichrono Livracha, whose unwavering commitment to community and to fairness and advocacy has shaped not only this program, but also the values that we here at Darchei Noam hold dear. Lauren's passion for social justice has left an incredible mark on our congregation, and this lecture series stands as a tribute to his efforts and the legacy he continues to build. So we join as a community and with members of his family this evening who are here tonight by learning in honor of him this evening. And so to frame this, I want to teach just a little bit of Torah. And I want to take us a few weeks ahead now to Parshat Mishpatim. We'll read it later in the winter, but in this portion we read one of my favorite verses. And I believe it to be one of the most influential verses of Torah, and it takes us back to the moment of receiving the guidelines of how we, as a Jewish people, should live. And it says this: Vayikach sefer habrit, vayikra be'oznei ha'am, vayomru kol asher diber Adonai, na'aseh v'nishma, which translates to Moses took account of the covenant and then read it into the ears of the people, which is a phenomenal translation. Thank you to Everett Fox. And they said, all that God has spoken, we will do and we will hear. And you heard that right. It is written, na'aseh, do, and then nishma, listen. So many of our commentaries on this verse state that this ordering of words implies that action comes first and then listening comes afterwards. Something doesn't seem quite right? This famous utterance has become symbolic of the selfless trust and faith that the people had in God. And the people agreed to act on the laws of God even before having heard them. And so this proclamation then is twofold. First, a repetition of their oath to follow the commandments, and then now they pledge to listen and to hear the stories of how they came to be. And so this sets the tone for the essential elements of Judaism, following God's law and listening to the narrative of the past. Sounds great. However, there is more than one way to interpret and to understand this verse. And so for a moment, I'll bring in my parents. Because if they would have written the Torah, if it was up to them, they would have reversed these two words so quickly. They would read it, nishma v'na'aseh, to listen. We will hear, and then to do, to put forth action. Now, they taught me from a very young age it is essential to listen, to hear instructions first, and then to go off and follow them so you do it correctly, appropriately. So how are we supposed to follow instructions before knowing what they are? So then I leave you with this question of how do we read this text? Na'aseh v'nishma, that we should do and then we should hear, or can we possibly interpret it nishma v'na'aseh? Should we listen and then should we do? I want to bring in a story from the Talmud that'll highlight just this. So, Rabbi Tarfon, who's a prominent rabbi during the temple's destruction, was sitting with the elders in the Jewish court in a town called Lod in the land of Israel, and a question was asked of them. The question was, which is greater, to study or to do action? And Rabbi Tarfon answered and said, of course, action is better. And then another rabbi, Rabbi Akiva, said, study is greater. And then we argued forever. But in truth, the community of elders debated this for a little while longer, and then they made this determination. They determined that study is greater because study can lead to action. And so this evening we are honored to welcome Dr. Philip Berger, whose expertise and advocacy work resonate with these values. And Dr. Berger's contributions to social equity and healthcare reform in Toronto exemplify the kind of leadership and moral responsibility that our community seeks to inspire. And so as we listen this evening to the conversation that is about to happen, may we be reminded of our duty to pursue justice and to deepen our commitment to building a compassionate and equitable society. And so tonight, let's start by listening. And then may these words that linger in our heart as we bring them in, may we then go forth to action, to making our world a better place. Shavua Tov.
Yesher Koach, Rabbi Ryan. I think we will be hearing a lot about learning, ideas, and action from Philip Berger. So this is my opportunity now to, I got the sense just from the many people who approached you, Philip, as you were here in the sanctuary. This is kind of a reunion, and so many people know you, and the affection that they hold for you was so evident in the pleasure that people took in seeing you again and being here with you. I had one problem in preparing my bio intro for Philip. He said, no more than 30 seconds. I've already done more than 30 seconds. So Philip, I'm going to let you down. I'm going to go more than 30 seconds, but audience, please know there is so much more that I could have said and that there is to say about Dr. Philip Berger. Philip, as I said, was born and educated in Winnipeg and came to Toronto to practice medicine in the late 1970s. Lucky Toronto. Throughout his career, he has championed and pioneered bringing healthcare to underserved populations. For these innovative practices, Philip Berger has been named an Officer of the Order of Canada, and he is a member of the Medical Hall of Fame. Here's part of the Order of Canada citation of Dr. Berger's contributions to Canada. I now start to quote. As an educator, administrator, and physician, he has improved care access for patients facing barriers in navigating the healthcare system, particularly those living in poverty, injection drug users, people with HIV/AIDS, members of the Two-Spirit LGBTQI+ community, refugees, and victims of torture. What a heart, what a service to populations who were being neglected and overlooked by our healthcare system. The Order of Canada citation also notes Philip's longstanding commitment to many human rights causes. Recently, Dr. Berger wrote an impassioned article for the Jewish magazine Tablet. I'm curious, show of hands, how many people have read that article? Quite a lot. I'd say a third to a half of the hands just went up, Philip. In that article, Philip reiterates his lifelong stance as a dedicated Zionist who is now being shunned by colleagues and former allies in progressive causes. So we have much to talk about this evening, about Philip's lifetime of activism. That's the title of tonight's program, A Lifetime of Activism. Philip, it's a great pleasure to have you here at Darchei Noam again. You have been in this sanctuary and congregation before. And the format in planning the program, the format we settled on was Philip and I, as I said, Philip and I will be in conversation, and then we'll move on to Q&A, and I'm reminded that the one part of the night's program that I forgot to mention was reception downstairs, one floor below, once the formalities are over. So there'll be opportunities to chat informally to Philip Berger downstairs in our social hall. So Philip, this is my my signal to call you up to join me as we sit and whoops, I think that's me who caused that. Yeah. So as you've heard, Philip, you have been a champion of healthcare for so many different marginalized populations in Canada. Can you take us back and put us in your footsteps? What put you on this path? What took you beyond what I and maybe others think of as the traditional practice of medicine to almost consider medicine as an applied tikkun olam and healing the world? How did you do that?
Well, it's been my encounters with individual patients that have actually propelled me on the pathway to advocating for individuals and also for politically engaging communities on their behalf and in support of them. The first major foray was actually serendipitous. I was asked to examine the Chilean refugee, a woman who was tortured by the Chilean junta in 1973 after the junta. And her refugee lawyer asked me to see her to see if there's any medical consequences and psychological consequences and sequelae to the torture. So I did examine her, and as doctors often do when a lawyer sends them a referral, wrote the lawyer back a note, quite a lengthy, detailed note, documenting her history of torture and what signs I saw of it. That lawyer happens to be a member of the Shul Brent Nazen, who throughout his entire career has shown a reverential fidelity to the most disconnected and vulnerable, throughout being a lawyer and a judge. Brent saw another value besides me reassuring him that she would be okay. He saw the value of that report as evidence in the legal refugee determination process and hearing for her claim, and he submitted it and used it. I'm not sure what the outcome was, Brent. I suspect she was accepted, but the word quickly got around to other refugee lawyers, including my wife, Frederica, who is a fierce advocate at the Center for Spanish-Speaking People and Partdale Community Legal Center for Refugees and other people. And there are other people, Nancy Goodman, Brent's partner, who is a refugee lawyer. The word got out, phoned Dr. Berger to get this documentation. Well, I couldn't do it alone. To be brief, a bunch of doctors contributed to this. There was an informal referral set up, and that became standard practice for these hearings. I should say that one of the results was the founding of the Canadian Centre for Victims of Torture, which is a permanently funded United Way agency that has seen torture victims from 123 countries and has taken care of about 36,000 people since it was founded almost 50 years ago. The second situation I found myself in as a very young doctor, about a year after I saw a Chilean, I was working at the South Riverdale Community Health Center, and the health center got a call from a man who was a veteran, lived in a downtrodden rooming house in southeast Toronto. And he phoned, or someone phoned on his behalf, I forget the details, because he'd been receiving collection agency notices for a hospital admission. He did not have effective OHIP, even though he was eligible. He was on welfare as a World War II vet. I went and saw him at home, and he was living on cat food. That was his nourishment. But his major distress wasn't the fact he was dying of prostate cancer. It was that he was getting these threatening collection agency notices saying they would take him to jail or fine him and take him to court. So the juvenile rage in me at the time, which I still have a little bit of, erupted magnificently, and I wrote a very heavy letter to the local teaching hospital saying lay off, and they did. But that propelled me down a pathway of consciousness about people living precariously and without homes and people who are poor in general. So it was always an encounter with an individual patient that got me going.
You know, as a follow-up, I'm still hearing echoes of Rabbi Ryan's interesting Devar, learning action. Would you say that your medical activities and commitments come from a learning place, even a Jewish place? Is there a Jewish impetus to the medical career you've had?
That's a tough question. David Rowland's saying no, no, no. He's sitting in the front. Thank you for coming. I can't claim that there's any deep philosophic or religious reason I've done anything I've done, quite honestly. I've kind of stumbled in it from issue to issue and patient to patient. There were some influences in my life. My maternal grandparents who came here as refugees fleeing from pogroms in Russia in 1921, my grandmother in particular always spoke about the welcome she felt here and the fairness and justice that she sensed in Canada. And I think fairness is one of our national traits in Canada. And I also, her oldest son, my uncle Max Walters, who was the first professor of cardiology in Vancouver, was legendary for his kindness and availability to the Jewish community in Vancouver on any issue, whether it was the heart or orthopedic problems or colds. So it was quite instructive for me to watch both of them in action and their kindness. The other thing that happened to me when I was around 18, I had finished first year university, and my hair was quite long at that time, and I went to Shakey's Pizza Parlor in Winnipeg, and I got kicked out of Shakey's Pizza Parlor because of my long hair. And I was quite distressed and outraged and told my professor, my biology professor, Professor Berger, what happened. And what he did, he actually wrote a letter to the Attorney General of Manitoba protesting on my behalf. Now, I know it sounds quite trite in 2024 to complain about long hair, but to a young, impressionable student, it really taught me that one can engage the powers of the state when pursuing one's rights. So I'm forever indebted to Professor Berger.
Philip, as the citation from the Order of Canada, which I read out, notes, you were really in the forefront. There were others, but you were in the forefront of providing equitable and respectful treatment to gay patients. This at a time when there was tremendous discrimination and harassment against the gay community. How did you get involved in that?
Well, I was lucky. We had a classmate in my medical school. I'm not outing him because he's very public. His name was Dr. Wesley Friesen. He's a psychiatrist in Vancouver now. He may be retired. I haven't seen him for years. And we happened to work together for 1 year in Winnipeg after I finished my rotating internship here. And he let me ask him any question I wanted to, unconditionally, without fear of antagonizing him, insulting him, or offending him about homosexuality, about which I knew nothing. And I learned from him intimate details of the persecution, the discrimination, the rejection from family and peers and classmates of being a gay man. He was quite an interesting man. He came in 1974 to our medical school graduation party with his then male partner, which is quite a daring thing to do in Winnipeg 50 years ago, believe me. So that he raised my consciousness tremendously about the persecution of gay men. And then when I came to Toronto finally, I ended up working at Hassle-Free Clinic, which was the busiest sexually transmitted disease clinic in Canada, and saw dozens and dozens of gay men and heard their intimate stories of discrimination. You know, I ended up on the streets in about 1977 when Anita Bryant came to Toronto. Anita Bryant was the sort of poster actor woman for orange juice in Florida, and she led this incredibly bitter homophobic campaign right across North America. And that was the first time I hit the streets with the gay and lesbian community. The second time was during the bathhouse raids in 1981, and I'm embarrassed to say I was 30 years old, and it was the last time I kicked a police car. Got swept up in the fervor and militancy of the street protests. So then I became known as so-called straight, gay positive physician and attracted many gay men into my medical practice.
Wow. What did you learn from that experience?
Well, I'll tell you, I saw gay men fighting for themselves on their own behalf, and learned that if a group or community are being persecuted, especially by the state, and being bullied, the only way you can deal with it is to fight back and resist bullies. I saw that in action. It was interesting in 1981 because it was a time when a lot of younger gay men were getting into bodybuilding. They were quite muscular and fierce looking. And I was with my brother Samuel. I took him, he lives in Tel Aviv. Took him from the airport straight to the demonstration for the bathhouse raids. And suddenly there's a bunch of queer bashers at the back of the demonstration. We were appointed instant marshals holding back the crowd from these queer bashers. But the crowd of these muscular men broke through our little human barrier and chased these queer bashers down the streets who ran like rabbits. It was quite a scene to see how scared they were. But I did learn the necessity of fighting back and of defiance.
And then came AIDS. And those of us old enough to remember, recall losing friends, remember the fear, the misinformation, the doctors who wouldn't treat patients with AIDS. What made you get involved in providing care to AIDS patients?
Well, as I mentioned, I had a large number of gay men in my medical practice and some injection drug users. During the very late 1970s, maybe 1980, 81-ish, there was about a dozen downtown Toronto family physicians who had similar practices. And we began to notice individual cases, not a lot, but clumps of cases of patients with weird infections, swollen lymph nodes, fever, rash, sore throat, and minor laboratory abnormalities that would all return to normal within 2 or 3 weeks. And we just described this some other viral infection they probably picked up in the bathhouse or while sharing needles. But in the meantime, the AIDS epidemic was exploding before our very eyes. We were never trained to look beyond the individual patient or gaze beyond the individual patient in the office and wonder if there could be some biological phenomenon causing these cluster of cases. And I always wondered, we can't identify biological causes. How can we expect students and doctors to identify social, political, legal, or human rights causes of illness? They were terrible days. I can tell you the doctors were shell-shocked at seeing wasted young men who often died of 4 or 5 ferocious fatal infections at the same time. There were colleagues who kicked people with HIV out of their medical practices, surgeons who refused to operate, and consultants who refused to see people with HIV/AIDS. I knew a doctor who moved out of her apartment building at Church in Wellesley because she didn't want to touch the elevator buttons where a lot of gay men lived. It was really, really terrible. But there were some victories, again, led by people with HIV/AIDS. The slogan, "Nothing about us without us," actually came from the AIDS activists back in the mid-1980s. One was the provision of anonymous testing, which means a person can come into a clinic, get HIV tested, but never identified to the provider or the state, given that HIV was a reportable infection. And it had been shown in the medical literature that the people who are at the very greatest risk of HIV infection are the very ones that will not come in if they're going to be identified. The government at the time, an allegedly social democratic government, no, actually it was the liberal back then, I'm getting mixed up. Liberal government opposed anonymous testing, but through advocacy and activism and street demonstrations, it was finally provided against the wishes of the chief medical officer of health of the province. So anonymous testing resulted in many, many people finally coming in for testing and being identified, which would avail themselves, for example, at the time of testing their immune system, given no treatments were available. The other major victory, which has set a standard for the rest of the country since, was access to experimental therapies that were undergoing clinical trials. And it was impossible to get access to treatments that seemed to show promise in early trials, experimental trials, because the drug companies and government would not release them. And this is classical state paternalism. The people with HIV and AIDS felt it was their bodies and it should be up to them to determine what risks they're prepared to take, including the risk of taking an unproven therapy. And through a series of mishaps on the part of the government and advocacy on the part of some of the downtown AIDS doctors that finally the government relented and allowed access to experimental therapies that was never there before. And that made a big difference because patients got access to, for example, AZT, the first anti-HIV drug, before it was approved. So those are examples of a community coming together. In fact, the AIDS activists all came out of gay liberation and used their skills and knowledge and expertise and cohesiveness to pressure the government to allow access.
Through all that, what kind of response did you get from your peers, other doctors? Were you a hero? Were you a pariah?
Well, it wasn't only me. I'm not trying to be modest. There was really about a dozen, eventually 24 downtown Toronto physicians. Many were, or some were gay physicians who came out for the first time in their life as a matter of defiance against an illness that was killing their friends, lovers, and peers. And as I mentioned, there were doctors who wouldn't see people with HIV/AIDS, but there's some magnificent doctors. There's a pair of young surgeons. One was named John Bonin, a Jewish surgeon, and his partner, Bob Mustard Jr., who were the only two general surgeons in Toronto that we knew about who would operate unconditionally on people with HIV/AIDS. There's a gastroenterologist at the Wellesley, Gabor Kandel, who would see people unconditionally with HIV/AIDS. So there's some people who demonstrated the virtues of kindness and availability and non-judgment to people who were dying of terrible diseases. There were other doctors who were not so popular with, and wanted nothing to do with us, but we were an organized group of HIV doctors, which made a big difference.
Another community you have long connected with and supported are people with addictions. We're in the throes of a horrible opioid crisis at the moment. Last year in Ontario alone, over 2,600 people died. 2,600 Ontarians died from opioid overdoses. The Premier is calling for the closure of safe injection sites. You've long been an advocate of them. Why?
I went to an international AIDS conference in Stockholm in 1988, where the first peer-reviewed evidence was presented on the benefit of providing clean needles to injection drug users. They demonstrated that the incidence of transmission of HIV, as well as hepatitis B and hepatitis C, was reduced if you could give people who are addicted to opioids and other drugs clean needles. So when I came back, I convinced my colleagues in Toronto, my HIV primary care physician colleagues, to agree to provide clean needles to anybody in their private practices who wanted it. And then we went public about it. I'm not trying to boast, but I was the only person who was prepared to put my name to it. I remember that because when we announced we were going to be giving out clean needles, I was driving my car downtown somewhere and heard the deputy chief of police saying that they'd arrest any doctor who gave out needles for peddling drug paraphernalia. Well, it never happened. He was bluffing, and 6 months later, Toronto Public Health actually opened the first officially sanctioned needle exchange program. But it was evidence at a peer-reviewed conference that led me to take action. As far as supervised injection sites go, there's solid evidence, much of it out of British Columbia, that when one provides supervision to people using drugs, the incidence rather of opioid-related overdoses goes way down. It saves lives. The actions of the Ontario government and other governments are based on moral objections, not medical evidence objections.
Another area related to addictions that you've recently been in the forefront of is the use of methadone. Why is that so contentious, and what's the issue around provision of methadone?
So just to explain, methadone is actually a highly addictive opioid medication also. It does not produce the same euphoric effects as heroin or prescription opioid drugs. It was a Canadian doctor, Roy Halladay, in British Columbia, who did the first study on the benefits of methadone back in 1965. And numerous studies since then had shown that if methadone can be provided to people who are addicted to opioids, the incidence of transmissible diseases through needles goes down, they can achieve social and family stability, become employed, and become stable. I'm a bit afraid to talk about this with Dr. Oded Samuel in the room, who's one of the leading addiction doctors in Toronto. You can correct me, Oded, if you want to. But that was what the evidence was. In 1991, I was asked by a psychiatrist at the then Addiction Research Foundation to accept a patient in my practice and prescribe her methadone, which I'd never done in my life before. It was a very highly regulated area. So I did take her, and then the word kind of got out and within her community and other people who use drugs that Berger's office is giving out methadone. And soon enough, more and more requests came in. My partner, Dr. Abe Hirsch, who's also from Winnipeg, began to prescribe methadone. And we became overwhelmed with the number of people who wanted to prescribe it. At that time, I should tell you, there was about a half a dozen doctors in all of Ontario prescribing methadone to about 120 patients. The estimates from studies at that time, which I read, were that there were between 40,000 and 90,000 heroin addicts in Ontario, and methadone was considered the gold standard treatment. So we became overwhelmed, and a public health nurse and myself organized a press conference at Queen's Park in February 1992, at which 3 heroin addicts went public with their names in the press gallery at Queen's Park in front of a packed room of media. I remember the press conference well because I had to point out to the media that I was a doctor and they were the addicts. So much for stereotypes of addicts or doctors. And it was a highly successful press conference that got widespread media coverage in the newspapers, on TV and radio. In fact, the Globe and Mail wrote up an editorial calling for increased availability of methadone. You couldn't do any better. But the then allegedly social democratic government of Ontario was completely resistant to any suggestion of providing methadone. So there's a little campaign that 2 of my patients then embarked on, a married couple who both had AIDS and both have since died of AIDS. And I'm just going to get my prop here. I moved away from PowerPoint to posters. So what they did was, the man was an artist, and he drew up a little 8.5 by 11 poster. Like, this is what it says. It says, heroin addiction. Methadone is the most successful treatment. If you want help or need methadone, phone Michael Berger, Deputy Minister of Health, and had a private inside Ministry of Health office number as a tear off in the bottom. deep throat in the ministry gave it to us. So on a cold Saturday morning in Toronto, they stapled it from the downtown east side to the downtown west side of Toronto in areas they knew were heavily populated by people injecting drugs. And that Saturday morning, I got a frantic, urgent phone message from Michael Decker saying he wanted to meet urgently on Monday morning. Well, I got a bit cocky and brash, I admit, and said, look, I don't cancel patients for anybody. You're going to have to wait till sometime in the week. He did come in on the Tuesday or Wednesday. I brought one of these patients with me who's a type of woman who kind of just grabbed your heart. You couldn't help but empathize with her. He came in like this, I remember, with the arms out like this, sitting up straight. And by the time an hour passed, slunk way out of the chair like this. And he said, I promise you we'll provide more methadone spots. And he kept his word. And 2 or 3 months later, announced funding for methadone at the Parkdale Community Health Center. And since then, the prescribing methadone has exploded. I don't know the current numbers, Oded, but at one point there were over 300 addiction doctors prescribing methadone to over 50,000 patients in Ontario. So here we have this unknown, anonymous couple, both who died of AIDS, who cracked open the addiction treatment system in Ontario.
Philip, one last question related to your contributions in the health area, and then we'll turn to the discussion of your very forceful pushback against anti-Semitism. The close, I guess, is a pretty big open-ended question. I think it's fair to say that there is a lot of distress, frustration, concern that Canadians have about the current state of our healthcare system. So if Healthcare System Canada walked into your office and said, give me a diagnosis, what's wrong with me, and what do you prescribe, Dr. Berger, what would the diagnosis and prescription look like for our healthcare system?
How many years do we have to talk about? I mean, there have been hundreds of articles and books and opinion pieces and editorials and letters to the editor written on this subject, and I could not feign to have a good answer. But I do recall during the prelude to the Ontario doctors' strike in 1986, and some of you will remember, some are too young to remember, but doctors in Ontario withdrew their services in defense of their right to extra bill patients' cash on top of OHIP. And the Ontario Medical Association led this campaign. I remember I went bravely to an Ontario Medical Association meeting because I was on the other side. And I heard this doctor walking out of the room and ranting, saying that I own my medical knowledge and I will do what I want to with it. Unknowingly, he was expressing a certain view and philosophy of medicine, which was that his knowledge was a commodity that he could sell at whatever price he wanted, decide who he was going to use it for, and it was like a piece of artwork. But there is another view of medical knowledge, and that is that medical knowledge is actually owned by the citizens and held in trust by physicians to be used for the benefit of citizens. And if it's owned by the citizens, in my opinion, have a full right to determine how that knowledge is used and delivered. Not to tell doctors what antibiotics to prescribe or how to do surgery or make any medical decisions, but under what circumstances should that expertise and knowledge be used. And I think that with that view, which will never happen because it's considered too radical a view, there could be some consequences. One could be, for example, that we expect that because we fund doctors' education for hundreds of thousands of dollars a year, we could expect a return of service. That if you're going to be educated in Ontario, you have to work 2, 3, 5 years, which is quite severe, in a designated under-service area designated by the government, whether it's in the inner city or in rural Ontario. The other thing that could be done is, which would be considered extreme, but I think it's worth considering, is that when people apply to medical school, rather than declaring in their third year what specialty they're going to go into, they have to declare up front. So you set up a family medicine stream and a specialist stream where changes would only be allowed by people exchanging positions. But it would guarantee the graduation of a certain number of family physicians who could then be put in places under the return of service rule. The last thing I'd say is, as you know, obstetricians everywhere take overnight call and weekend call 24 hours a day. Family doctors in Ontario are not required to do that. And I think as a condition of their receiving payment under OHIP, they should be required to provide after-hours telephone availability and call, which is not the case right now. So I guess to summarize, it all comes down to the accountability of doctors to citizens through the state. And those are just some small examples, maybe big, of what could be done.
And still your peers inducted you into the Medical Hall of Fame. Good on them.
No one takes me seriously, that's why.
Yeah. Getting very serious now and shifting gears. I made reference to the very passionate article in Tablet that Philip wrote. It's titled Progressive Except for Palestine. Progressive Except for Palestine. It's available online. You could search it if you haven't had a chance to read it yet. Philip, in that article, you called out what you see as the anti-Semitism of the progressive community, and you cited past colleagues who were on the same side as you were in any number of issues who now shun you because of your commitment to the state of Israel, and you're openly declaring yourself as a Zionist. So I have a few questions connected to that article, and I'll ask them in one batch. Can you tell us what compelled you to write that article, what the response has been, and there's one particularly striking passage in the article where you say, I am a Jew, therefore I am a Zionist. Attack me as a Zionist, you attack me as a Jew. So I'll ask you to elaborate and on that last thought with us. I've shared these with you, so I'm not springing all of this on Philip out of the blue. And Philip has been very thoughtful about how he conveys his views and messages about Zionism and anti-Semitism, and I know, Philip, that you've written out what you want to tell us at this point. So up to this point, we've been in informal conversation. Philip will now read remarks he wanted to put on paper to share with us about that article, and it'll probably be the longest answer of the evening. And then after that, we will move into the Q&A.
I'm going to try not to read it.
Okay.
I'll refer to it occasionally.
Good.
The reason that I wrote that article was that I felt a direct through line, direct connection from the anti-Zionist and sometimes anti-Semitic protests that I observed on the streets and on campuses across Canada to my own personal experiences with anti-Semitism and with social and professional ostracism. I had to get it off my chest, and I wanted to communicate my and the moments of utter despair and isolation that I and many of my Jewish colleagues, some of whom are here tonight, have been feeling since October 7th. That's why I wrote the article. To me, and I can only speak on my own behalf, to be a Zionist in 2024 means that I accept the right and necessity of the survival of the Jewish people and the need for a Jewish state to ensure that survival. Hence, anything which undermines or threatens the survival of Israel also undermines or threatens the existence of Jewish people and is ipso facto anti-Semitic. I do not believe, and I apologize to Dr. Steve Samuel for saying this, but I do not believe that good faith criticism of Israeli government policies, the differential treatment of Arabs in Israel, the settlements, or even criticizing some elements of the prosecution of the war constitute anti-Semitism. I know some people will object to that statement, but my view, not uncommon in Israel, does not transgress the unity of supporting and believing in the existence of a Jewish state and the right of Israel to defend itself. That, to me, is a definition of Zionism in practice. I view the twisted logic and belligerent slogans of large swaths of the left and progressive movements in Canada, particularly in the past year, but also at a lower intensity over the past number of decades as a cultural and political existential threat to Israel and to the Jews. I take literally the proclamation that from the river to the sea, Palestine will be free. I know that the professional anti-Israel agitators themselves know full well that this geographic reference to the Jordan River and the Mediterranean Sea is really code for replacing the entirety of the state of Israel with a Palestinian state. And nothing could be more anti-Semitic in intent and substance than that. And to me, it is pure sophistry to suggest otherwise. It's the same, in my opinion, with allegations or accusations of genocide, settler colonialism, apartheid, all of which are meant to cast Israel as an illegitimate, illegal, rogue, or unlawful state, and which can only lead to the dismantling or taking down of Israel as a Jewish state. I've always felt that the distinction between anti-Zionism and anti-Semitism is artificial, and that distinction evaporated in 2001 at a United Nations sponsored international conference on racism, when non-governmental organization, Palestinian-connected groups distributed anti-Semitic materials, including handing out the protocols of the Elders of Zion, distributing T-shirts with a swastika and Magen David on it, and holding placards up high saying, "If only Hitler had won." This expression of raw Jew hatred undermined and vitiated, in my opinion, any claim that Palestinian solidarity is rooted in anti-racism. And even if you believe that Palestinian solidarity is rooted in anti-racism, Jews are singularly excluded. In Toronto, the proposition that somehow anti-Semitism and anti-Zionism are distinguishable was laid to rest late last year and early this year, when over a 6-week period, on Saturday mornings, the Jewish Sabbath, protesters occupied and blockaded the 401 Avenue Road Bridge, the gateway to one of the most populated Jewish areas in Canada. One of the spokespersons from the protesters was interviewed and said that the reason that bridge was chosen was because it was a Zionist-infested area. Look at the language, infested. We all know where and when and for what purpose that language has been used in the past. I was asked by a Jewish colleague a while ago to what degree or at what point would the death and destruction in Gaza be indefensible. And before I could answer, she asked a follow-up question was, if that point was reached, would I publicly speak out about it as I have for many other issues in my life? I did not have answers because the related and relevant issues of international law, geopolitics, and the morality of war are all tainted, in my opinion, by accusations of genocide against Israel. Indeed, genocide has become the premise of almost every question asked or assertion made by critics of Israel. And so I didn't have answers for her. And I think as well as genocide, arguments about proportionality, legitimate military action targets, rescue the hostages, and even the carnage in Gaza itself are all tainted by this underlying premise of genocide. And yes, in Gaza, it is a cataclysmic catastrophe. The suffering and horrors are unimaginable. I know that we're all psychologically weary and emotionally drained and depleted. And at this point, I'm going to defer to the rabbi of my synagogue, first now Rabbi Ed Elkin, who said in his first Rosh Hashanah Day sermon, I'm going to read it so I don't misquote him, that we must, quote, recognize the humanity of the person we don't know, someone who might be a threat, but not be, someone who might be worthy of our assistance and our care just because they are human. Rabbi Elkin spoke further of complexity, meaning that, quote, we can shed tears of joy when hostages are released or rescued, and tears of compassion over Palestinian civilians who are killed. That is what he said the Torah teaches us. But I still worry that the answers and opinions proffered by especially international non-governmental organizations and the United States towards Israel are determined more by animus to Israel and a rejection of the idea of a Jewish state than by an honest reckoning of the issues. I'm only human, and I don't have answers to any of these questions. Finally, as to the second question my colleague asked me about at what point would I publicly criticize Israel, it is highly doubtful that I would ever participate in such a criticism. Israel has enough critics locally, nationally, and internationally without me piling on. I do pray that the rockets and bombs, the suffering, death, and destruction in Gaza, Lebanon, and Israel will stop, that the hostages are released, that Hamas and Hezbollah are out of power, that the existence of Israel as a Jewish state will be accepted by its regional neighbors and by my colleagues in the left and progressive movements, and yes, that Palestinian self-determination is secured. That's enough, and I'll stop there.
That's a lot, and you've shared a lot of learning with us. You've also given us an idea of how magnificently impactful action that is caring and that thinks about the needs of those whose pressing needs are not being met by institutions. Again, back to this dichotomy of learning and action. They're actually combined and need to happen in concert. I imagine I know you've given us a lot to think about, and I imagine there are a lot of questions. Some have already come in via Zoom, and as I mentioned Zoom, I'll again say welcome to all of you who are watching us on Zoom, and a special shout out to our member Kathy Sikora, who has hosted the Zoom portion of tonight's program. I think what I will now do is call our member Rebecca Fish, who has been monitoring the questions that have come in on Zoom. And I think she's likely in a position to start asking you some of the questions that have come in on Zoom. And while that's going on, I'll ask our terrific chat students to wander the room row by row and pick up any cards that have been filled out with questions. And if you bring those forward, I'll review those, curate those. We have a chair for you, Rebecca, and a table over here.
Meyer, before we begin, can I just make a comment? I wanted to thank the shul. I meant to do this at the beginning, but I was too nervous for inviting me to speak tonight, and particularly to the Merkur family for sponsoring the evening. I also am grateful to the chat students who are volunteering here today, and to the team group of the shul who submitted questions ahead of time, astute questions and difficult questions. I also have to say I see a lot of people from Winnipeg here, some I've not seen for years. I'm not sure if I should be elated or scared, but I'm glad to see you anyway.
The Winnipeg reckoning comes downstairs in the reception after this session. I'm sure it'll be a very warm and excited one. So Rebecca, I don't know whether any questions have come in so far on Zoom. Over to you, and I'll await whatever handwritten questions there are from the in-person.
Okay, so one of the questions is very specific, Dr. Berger, which you may or may not, I don't know the reference, but I suspect you will, which is, what do you think about this, more about your conversation about what we do about the medical system going forward? And the question was, what do you think about Jane Philpott's ideas about reorganizing medical care?
Well, I know Jane Philpott. She's brilliant, and I haven't read her book, but I've read a number of her opinion pieces. It would make sense of the personnel over there. I think part of the problem is these ideas rotate over decades. The idea of a home for education, medicine, preventive services is not a new one. What's new about her proposal is how it's to be organized. And in the absence of people to staff it, which aren't there right now, I mean, I don't have to tell people in this room how difficult it is to get a family physician, never mind a nurse practitioner, a social worker, and a lawyer, and a teacher in some communities. I just don't see it happening quickly, which is why I believe in return of service.
Thank you. Another question that came in is, could you please discuss, I think you've done this to some extent, but could you please discuss the work you've been doing to fight back against the anti-Semitism in academia and in medical settings?
Well, you know, I have to rely on the preeminent group, I think, of health professionals fighting anti-Semitism, which is called Doctors Against Racism and Anti-Semitism, DARE, which has been around for 16 years. I don't agree with a lot of their personal politics, but I admire their feistiness and defiance and fighting on behalf of Jews. They have made major advances in the Faculty of Medicine at U of T. For example, they were responsible for introducing a Holocaust curriculum at U of T, which has now gone across the country in every single medical school. When Irvin Cutler was accused of contributing to anti-Palestinian racism in January 2022 after delivering a keynote address at the Holocaust Remembrance event, he was accused by 45 faculty of contributing to anti-racism, Palestinian racism. DARE sponsored a petition that was signed by 350 faculty calling out the anti-Semitism of the 45 faculty. The faculty never repudiated that 45-person letter, but at least it's on record from DARE that it was done. The other thing that DARE did was in November 2023, sponsored an open statement proclaiming the right of Jewish physicians in the faculty to be openly Zionist without fear of recrimination, isolation, discrimination, or persecution, as well as that document endorsed the IRA definition. 555 Jewish-only physician faculty signed that open statement, which commanded attention in different sectors across North America, and that still has legs to these days. DARE, and I really can't speak, I'm not in their board, I sort of am behind the scenes, but has been justifiably disappointed in the response of the Faculty of Medicine and the University of Toronto on many fronts, but we get a sense there is some movement recently. President Girdler, in remarks he made to a conference on anti-Semitism, at which representatives of the Jewish Medical Association of Ontario and other association of health professionals were speaking, did acknowledge that Zionism could be a core part of the identity of Jewish people, and that any discrimination or perception of persecution because one was a Zionist or an Israeli would fall under a protected category for the faculty. It may not be permitted. He didn't quite go far, but he went much further than he ever has gone before. It's a mess in the faculty. I know that Jewish students are sitting in terror. I mean, it don't even to me such a strong word, but they feel under siege. The faculty feels under siege. Professional relationships have been disrupted with non-Jewish peers who are quite hostile to Israel. There are a number of well-known virulently anti-Zionist physicians who post regularly and who work in the teaching hospitals. It's a mess. What can I tell you?
So, further to that, and then I'll turn this over to Meyer, but someone asked how you have responded sort of personally to the colleagues that you've worked with who have shunned you, and have you found them to be receptive to your perspective when you're dealing with them one-on-one?
Well, you know, I've had nothing to do with them. There are people who had regular coffee dates, lunch dates with, phone calls, I was even invited to social events that they've held. I've just not heard from anybody. And because I'm senior and viewed as having a lot of power, I don't want to approach them and intrude and impose on them, because then I'd be accused of abusing my privilege and power. So I'm happy to talk to any of them if they wanted to talk. There is one close colleague, a very close colleague, a lapsed Ismaili Muslim, who is like a brother to me, who we talk all the time and openly. He doesn't agree with me on a lot of issues, but we talk civilly and honestly to each other. And there's some things he just doesn't quite understand, and one of the things he doesn't quite understand is the almost inbred genetic fear Jews have of annihilation or death from anti-Semitism. But he tries, so it is possible, but I'm not particularly hopeful at this time. You know, I did learn some lessons when I was younger, because one of the things one has to overcome in dealing with social political issues in medicine, or perceived anti-Semitism in medicine is to overcome the fear. And I wrote about this in Tablet, but when I was about 14, 15, going with a bunch of Jewish friends of mine to the Red River exhibition in Winnipeg, a group of Army kids from the Army base on Kenneson Boulevard approached us and started hassling us, threatening us, and pushing us around. And all of us ran, except for my oldest, closest friend named Michael Bookbinder, who I knew since I was a year old. And he was 6 months old, who stayed and fought and got beaten up. He was fearless. And then the other person who was instructed to me was a classmate of mine named Dr. Aaron Plosker, who's an obstetrician in Fall River, Massachusetts, who in grade 10 was on the football team. And the captain of the football team at Grand Park High School kept pushing him down the hall and saying, effing Jew, effing Jew, effing Jew, and shoved them all out into the schoolyard. And there were about, it looked to me like 200 kids crowded around. There were probably 50, and the Jews were on one side, and the non-Jewish students on the other side. And the football team captain was about 6'4", and Aaron's about 5'9", but he's built like an Israeli tank, very muscular. And so Aaron knew he was into the fight and started taking his winter coat off so his arms were immobilized. And the captain of the football team slugged my friend. Big mistake, because Aaron threw his coat back in, got into a complete rage, and smashed the guy going upwards in his face. We started going down, only to meet Aaron's knee, and the captain of the football team lay unconscious and bleeding in about 15 seconds. So I learned then the value of fearlessness and overcoming fear and fighting back.
I think you've just answered one of the questions that came in. How do you get the courage for all your fights for marginalized populations?
Well, part of the answer I have is just overcoming fear of speaking out and acting. I don't mean to boast, but I was tested once when I was about 26, 27. I was doing a residency at St. Michael's Hospital. And I used to park at a local Church Queen parking lot. I don't think it even exists anymore. But in that parking lot, there was a Guyanese man of Indian ancestry who was in the booth. And I would kibitz with him and joke with him, and, you know, very friendly all the time. And one day when I was finished work, I came to the booth in the parking lot, and these two big, stocky white men, fairly intoxicated, with a industrial-sized broom, threatening him, saying, "Go back to Pakistan." By the way, anybody not white back then was a Pakistani, according to the racists. And they were threatening him, and I didn't know what to do. I'm standing there, I said, "You know, you claim you're a progressive, a human rights activist, you're principled, and are you going to walk away from this?" And I decided I couldn't. It was a complete intellectual decision. If one's going to be in a fight, it's better to be in a rage to do it intellectually, but I only knew intellectual. So I said to myself, okay, you're going to say to the guy the following, and I did say, I said to these guys, if you take one step closer, I'm going to effing kill you. I yelled at them. And I said, if you take a step closer, put your elbow behind your arm, close your fist, and hit him as hard as you can in the face. Like I took a step forward, I went boom, boom, like that, flat out on the ground, bleeding like my friend Aaron Plosker's adversary. And they both got up, stumbled, and walked away. And I heard later that one of the guys I slugged had about 15 stitches put into his face at St. Michael's Hospital, where I worked. So, but it was a test for me, and it showed me that if one was going to be afraid to speak out or act, you'll be shackled for the rest of your life.
There's a question that I think you'll be interested in hearing, and it connects to this because it wonders about possible familial influences that you've had.
My sister Gil is scowling.
Well, here comes the observation. I hope I'm not doing anything bad by Shani saying thank you for this comment. It comes from Shani Mankowski, who's here, past Toronto school trustee. And Shani says, I was born in I'm going to leave the date. I was born at the St. Boniface Hospital, probably one of the early patients of the Mall medical practice. Your father was one of the physicians who treated me. Did a connection with those doctors and other cultural social milieu and their cultural social milieu influence you? I remain grateful these many years later.
There were a number of Dr. Bergers. One was a pediatrician. My dad was a dermatologist. I'm not sure which one you're... Many people confuse them over time. My Uncle Morris was a pediatrician on North Main Street. My dad was in the Boyd building. You know, I was surrounded by doctors. I didn't realize how unusual it was. My dad was a doctor. Michael Morris is a pediatrician. There's a brother, Benny, who was an ophthalmologist. Michael Max was a cardiologist. My mother went to medical school. I have a sister and a brother who are doctors. My other sister married a doctor. My sister's a doctor, married a psychiatrist. So it was just kind of normal to be around doctors. I did learn one thing from my father, because he was born and raised in Estevan, Saskatchewan, and spoke about how he had to fight his way through school, running the gauntlet. And he was a tough guy. And he fought the coal miners' sons and eventually went to medical school. And here's an interesting story. He could not get a position for interning because of the quota system against Jewish applicants. And my Zeta, who lived in Estevan, was a general store owner who died in pecunious, actually, supported by his kids. But he used to donate blankets and other supplies to the local Catholic teaching hospital run by the then Sisters of St. Joseph. So they knew my dad's family very well. My dad came back after not getting a position and met Sister Zephyrias, the head sister of St. Joseph in Estevan at the time. She said, "Saul, how are you? What's going on?" He said, "Well, I don't know. I can't get a position to intern because of the quota system." She paused and looked at him and said, "You've got one at St. Michael's Hospital in Toronto. I guarantee it." She didn't say, "I'll investigate it, I'll ask, I'll pull some favors." And sure enough, that's where he interned in 1943, probably one of the very few Jews ever to be in the system at that time. Then he went to Manhattan to train with a leading dermatologist in the States named Dr. Marion Sulzberger, who treated the elite in Manhattan. My dad would talk about seeing the Rockefellers and all these wealthy people in his office. But as it happened, my dad was in Manhattan on November 29th, 1947, and he created a false press pass saying that he's from the Estevan Times, and snuck his way into the General Assembly and witnessed a vote of partition to create the State of Israel with his false press pass, and then went onto the streets in Central Park in Manhattan and danced away with tens of thousands of other people all night long.
Wow. Wow.
I'm talking too much.
Not at all. So apropos of that, one of the comments, not a question, but a comment says, "I don't want you to think that Philip waited until he was in his late 20s to become an activist. We were members of the Jewish youth group of Kadima in Winnipeg in the 60s, and as the U.S. was getting embroiled in Vietnam, we invited a member from their consulate to come and speak to us. Philip led us in a barrage of questions, questioning the validity of the war and essentially eviscerating the arguments advanced by the speaker." So it's a long history.
Well, I have no recollection of that event. But I do have to make one important correction. I was never a member of Kadima. I was a member of a group called Nagid. Absolutely. And they always used to say Nagid at BBG, because they made fun of all the nerds and feminine types, so-called, in Nagid. But I think it may have been a joint session, actually, of Kadima and Nagid at the time.
Philip, we're almost towards the end of the conversation. There'll be more downstairs, informal. A couple of questions related to your article in Tablet and views about Israel and antisemitism. One asked if you could say more about what response you have gotten to the article, and the other, someone asks, how can you still believe in a two-state solution?
Well, the latter, to me, there is no other solution. I mean, it's just simply what I believe. I think it's completely unrealistic that one group of people can control another group of people. I understand all historical arguments. I certainly understand the indigeneity of the Jewish people to the land of Israel. I understand all that. I agree with the arguments, but it's not realpolitik. It's not. That's in my opinion. The others may disagree, and I respect those views, but I just think there is no other solution. It'd be catastrophic for Jews, for sure, if there's a Palestinian state. It'd be catastrophic for Palestinians if there was one Jewish state for the entire area. So it's a simple answer. I'm no expert in these international affairs. I feel a bit reticent in even giving an opinion. As far as the response to the article goes, I was really quite afraid that I'd be attacked on social media. Smartly, I've never been on social media, which means nobody could track me. There were numbers of my colleagues, including some in the audience today, who were being doxxed and harassed because of comments or likes they put in social media, but they could not get me. But I did have some moles, including Dr. Sloan Freeman, a very well-known advocate for Jews and pediatrician at St. Mike's, who checked out social media for me. I said, come on, I must be attacked. She says, nothing. A week later, anything? Zero. I was kind of disappointed. I was completely ignored by people who would dislike me or be against me. But I have to say, I got probably nearly 100, I'm not exaggerating, really positive emails from across the country, including about a dozen from non-Jewish people, including actually a welfare social worker I work with at the South Riverdale Community Health Center in the late 1970s, early 1980s, who said she's critical of Israel, but she was distressed to hear what was going on, and she remembered that she would send me patients and I'd write supportive letters for welfare. But it was a really reassuring email. So I would say I only heard positive results, while I'm sure there's muttering at the wall negatively about me in rooms I'm completely unaware of.
Any last question you have from Zoom? So, we will apologize for questions that came in that we haven't had a chance to pose publicly. We are getting very close to the time we should be heading downstairs and giving Philip a chance to catch his breath. So we now move into the closing finale part of the program, where I'm going to first call on members of the Merkur family to come up and make some remarks. They will then call on our senior Rabbi Tina Grimberg to close the evening. I want to just say on behalf of the committee that has organized these lectures, how grateful we are to the Merkur family. Your encouragement, your commitment to this, your support of what we've been doing over 4 years now has meant a lot to us. Thank you.
Thank you very much. Thank you.
That was awesome, first of all. I was not expecting a turnout like this, so this is really, really cool.
Hi, I'm Leanne.
And I'm Ori. We are the proud grandchildren of Myra, a member here.
On behalf of the Merkur family, and in memory of our beloved Abba, we would like to thank first Philip for sharing your insight with us here tonight. We have been inspired to overcome fear, use our voices, and act on our values.
Next, Meyer, who stepped in at the last moment to moderate for the live audience. Rebecca, who did the same online, and also Esther, who spent an enormous effort preparing for this event.
May I ask the members of the Merkur committee, if you're able, to please stand? No pressure. Diane, the chair of the committee, Kat Meyer again, Laurel, Carol Parker, Carol Garson, Suzanne, and Ben, you've all put significant commitment to making these events a major success. Thank you.
The team also includes students from chat. A big shout out to Noam, Nathan, Naomi, and Madison. Hulakavod.
Tonight would not happen without such a highly dedicated group of volunteers. Let's just give them one more big round of applause.
We'd like to invite everyone to continue the conversation and enjoy refreshments in the social hall downstairs.
But first, let's listen to a few wise words from the wonderful Rabbi Tina. See you later at the schmooze.
To all of you, thank you for making tonight an important evening, and of course to Dr. Berger for your courage and commitment. I just want to take us it's a bit of a feedback, to a walk I took with Lauren of blessed memory when the concept of Merkur lectures was born. And it was a fall day, a very beautiful day with sparkling yellow leaves of Earl Bale Spark. And Lauren, a dear friend to me, said, you know, I was born to a privileged family where issues of social justice and equity was part of our conversation. I was a lucky Toronto boy, but that's not the case for everyone. And therefore, I would like to make a difference, and maybe your community can help me do so. In honor of Lauren's mother, Myra Merkur, and the family, this idea was born. It took us several years. It was a committee that helped to build, and it was a generosity, a seed, financial support that could let us do this. I would like to say that when, can you still hear me? When, as you know, when someone dies in our tradition, we become the mourners and the ones who love the person. We become their eyes, their hands, and their feet. Getting to know Tali, Leanne, Ori, near the bed of your father, taught me that Lauren's eyes, feet, and hands will continue to do great things. Lauren's children and family committed to 5 more years, twice a year lecture series at Darchei Noam to continue this extraordinary work. May Lauren's memory be for blessing. We miss him, and we're also honored to do the right thing. So I finished with the words of Pirkei Avot, I paraphrase it, where our sages ask us, make your house a place where gathering of the wise people can take place. Sit at their feet, at the dust of their feet, and drink their words with thirst. Our dear participants, Dr. Berger, it was a privilege to sit at your feet and drink your words with thirst. Get home safe. Good night.